Introduction to IV drug administration. When we're talking about IV drug administration, we understand that we have the direct access to the circulatory system, so we have a really rapid drug action. Pulmonary circulation time through IV drugs will be approximately 12 to 15 seconds. And with systemic circulation time, it reaches the systemic circulation within 17 to 23 seconds. So it's very, very quick. IV drug administration also avoids the pain and irritation that can accompany intramuscular or subcutaneously administration of particular drugs. It also provides an alternate route of delivery for drugs that would otherwise irritate the gastric mucosa or might be inactivated by gastric juices. So it can also provide that alternate route of drug administration for patients that cannot tolerate fluids or drugs by taking it orally. The drugs can also be titrated to achieve a desired therapeutic response. And with blood sampling, we are administering IV medications, and we need to know, have we reached therapeutic doses? Are we at the levels of toxicity of the drugs, etc. So we sample the bloods, and we can run, for example, like a vancomycin peak level or a vancomycin trough level. Well, peak levels are drawn after the completion of a dose, and it will let us know if we're reaching the appropriate level. However, the trough level is going to be even more important because it's drawn before we administer a subsequent drug dose, generally within 30 minutes prior to the administration of that dose, and it lets us know if we are maintaining consistent blood levels. So the interval between completing and obtaining a blood specimen will depend on the type of drug that we're infusing. Because adverse reactions can occur with the same rapidity as the desired response, unexpected effects of intravenous drugs can be very serious, and they might even be fatal. So this is a major hazard. It's very important to make sure that we identify the patient properly and determine the patient's allergy history. The key is prevention, not intervention. So let's prevent something from happening instead of having to deal with the consequences of an adverse effect. Aseptic technique with IV drug administration is essential. Inaccurate drug dosage can occur because of the absorption of the drug in the fluid container or the administration set tubing. So you may think you're giving a certain dose and it's now altered because it has been partially absorbed by the materials that you're using to transfuse it. There is a potential for incompatibilities when one or more drugs are added to an IV solution, or when you're attempting to administer a piggyback or administer a drug through a Y port of an IV administration set. And there is the risk of extravasation of a vesicant, and that can cause tissue necrosis. One of the most common ones that I have dealt with my hospital career was dopamine. If dopamine gets into peripheral tissues, it can cause necrosis. So it requires very, very intensive monitoring of an IV site if it's going through a peripheral site. It's important to understand that airborne bacteria can interfere with the aseptic technique, and it can also find its way into unprotected IV solutions that might be hanging during an intermittent infusion. The skin is the main source of bacteria that's responsible for infections having to do with intravenous infusions. Resident bacteria that adheres to the skin include Staphylococcus albus or Staphylococcus epidermidis. In the hospitalized patient, we may also see Staphylococcus aureus, Klebsiella, Enterobacter, and Serratia. Most hospital-acquired infections are now of the gram-negative type. To help prevent infection and to improve intravenous transfusion safety, we need to determine if the patient has a latex allergy. If so, we need to make sure that we're using latex-free equipment. We have to adhere to strict hand hygiene. The alcohol-based hand rubs are really preferred for routine hand hygiene because it will kill more bacteria, unless the hands are visibly soiled, and then it is necessary to use soap and water. We perform hand hygiene before and after touching a patient, before and after a glove change, when we move from a contaminated body site to another site, after touching an inanimate object within the vicinity of the patient. We should never use artificial nails when performing infusion therapy procedures because they have been associated with the transmission and outbreaks of infections. And we've got to remember that hand hygiene is the #1 way to prevent the spread of infection. Our goal is a 0% infection rate. Using scissors when performing intravenous infusions is limited to suture removal and during the procedure of catheter repair. The scissors should be sterile, they should be disposable and a one-time use. They should not be used to remove vascular and non-vascular access device dressings, tape or stabilization devices because of the potential of patient injury and or equipment damage. Using scissors should be established in organizational policies and procedures, especially when it comes to IV therapy. With safe handling and disposal, all blood-contaminated sharp items, including but not limited to needles or stylets, surgical blades, and syringes, shall be discarded in a non-permeable, puncture-resistant, tamper-proof biohazard container. If durable medical equipment is used, then it has to be decontaminated and re-sterilized according to facility policy. Never recap your sharps, and never attempt to put a discontinued saline lock into the sharps container. I've seen nurses do this on a routine basis, and I've seen nurses teach student nurses to do this. These items should always be placed in a biohazard bag because if you think about it, when you are trying to push a flexible material into a sharps box, you are at risk for puncturing yourself with used sharps. All biohazard materials, waste, and drugs should be discarded in the appropriate biohazard waste containers. Solution contamination can occur during the mixing of drugs. Sometimes a filtered needle is required or recommended, and it should be used. When accessing injection ports, these ports should be cleansed for 30 seconds with a 70% alcohol solution, and they should be allowed to dry completely. By improper protection of tubing of intermittent infusions, contamination can occur. So we're also encouraged at this point to use single-use intermittent IV tubing. Contamination can occur by allowing the IV bag to hang for prolonged periods, such as over 24 hours. If a bag is on a shelf, or sometimes during handling, punctures can occur to the bag. You have to be certain that you're checking expiration dates on solutions. And solution contamination is more probable in nutrient-rich solutions such as TPN or blood. So when TPN or the parenteral nutrients are prepared, they should be prepared with the use of a laminar hood, which helps keep everything sterile, and follow protocol such as appropriate tubing changes. And make sure that you're following patient care guidelines for parenteral nutrition and/or blood and blood product administration. The scheduled let me back up. The schedule for the change of IV tubing and solutions. Always follow facility policy. Always follow facility policy. But usually it's going to be about every 72 to 96 hours for most IV tubings and every 24 hours for open solution containers. And that's going to help reduce IV-related infections. Now that's tubing and solutions. Now for TPN or blood products, that changes slightly. With TPN, you change it every 24 hours. With blood, if you're infusing the same type of product, if it's going to be less than 4 hours, you can use the same tubing. Otherwise, you should use new tubing with each product. So, infection control guidelines and policies include that all staff will follow the latest guidelines for principles of infection, prevention, and control, routine practices that include hand hygiene, application of personal protective equipment, and appropriate sharps handling and disposal, and of course additional precautions, and appropriate cleanup of blood and body fluid spills. All IV insertion sites should be cleaned with a vigorous friction rub using a 2% chlorhexidine or a 70% alcohol solution prior to insertion. So vigorous scrub, and that site has to dry completely prior to inserting the catheter. All IV injection caps should be cleansed with a 70% alcohol for 30 seconds and allowed to dry before accessing. All IV sites should be covered with a transparent dressing. This allows the ability to assess the site routinely for signs of infection. A securement device should be used to stabilize the IV catheter. Some transparent IV dressings, such as a Tegaderm IV Advanced, are also rated as a securement device. But there's also standalone securement devices that can be placed under a sterile dressing. Those also should be changed about every 7 days. The use of an IV basket or an IV tray is really discouraged because it's a potential for cross-contamination between patients. Single patient use IV start packs should be used whenever possible. And you take a minimum of IV supplies into the patient's bedside when you're getting ready to perform IV therapy. Unused supplies that have been in contact with the patient or their bedding can be wiped down with a disinfectant wipe, provided there's no blood or body fluid contamination. If they are contaminated, though, they should be discarded before leaving the patient bedside or room.